welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart. I'm the stroke nurse navigator here at the Norton Neuroscience Institute Resource Center. And with me today is my now longtime coworker, Caitlin Zoeller. She is one of our social workers, and she specializes now in getting patients the resources that they need to get the care they need to prevent stroke, as well as deal with a lot of other memory and other issues like that. So thank you for being with me today, Caitlin.
Yes, thank you so much for having me.
Yeah.
Yes, it's very exciting.
So I know from experience and hearing you talking to patients for years that you are really well versed in what resources are available transportation-wise for patients after they've had a stroke, and having those conversations with families about how to organize around the available resources. So we'll go through some questions and you can talk us through the process, okay?
Sounds great.
All right. How does losing the ability to drive affect a stroke survivor's mental health?
You know, I think it goes to connect to that loss of independence that can come with any kind of medical emergency that you have. When you go from being completely functional, or at least moderately functional, to being able to having to rely on people and having to ask for help and things like that. You can go through a real grieving process, grieving that loss of independence and autonomy. And we see this in both men and women, but especially in our men, it can be really hard to say, look, I need some help, and I need you to drive me places. I need you to take me places. And that can be really scary and intimidating and quite overwhelming.
And a lot of people may not want to burden their family members. They're like, well, they have to go to work, so they can't take me here or there to these doctor's appointments, so I guess I just can't go.
Right.
And they will choose to not go rather than ask someone to take them because they don't know of any way. So we want to talk about ways that might be available that are not just family transportation, with the understanding that a lot of the time the expectation is that someone will have a family member who can drive them after they've had a stroke. So does that sound like what you're usually encountering?
Yes. We want to prevent this suffering in silence. I don't want someone to sit at home and be grieving that loss of independence when there are things available to them that they can use to kind of get their life back and get back into some normalcy.
Exactly. So what accessibility challenges do stroke survivors face when relying on public or alternative transportation?
Well, especially if you live in a big city, for those of you watching this that live in areas where there is public transportation, like bus systems and things like that. Bus stops, sometimes there's a long walk to the bus stops.
Yeah.
When you get on the bus, if the bus is full, you have to stand and hold on to a railing. So then we're talking about balance issues and going up the steps to the bus. So that kind of accessibility piece can get really difficult if you have some physical limitations. And then there's things, if you live in a rural area and you don't have public transportation, that can get really troublesome. Now, if you can't drive anymore because of some physical limitations and you don't have public transportation, you may be in a situation of, my gosh, what am I going to do now?
Yeah.
And have to figure up a completely different plan.
Who you're going to call?
Yeah.
Not Ghostbusters.
Not for this.
Exactly.
Yes.
Yeah. So are there assistive technologies or adaptations that can help people get to where they're needing to go?
Yes. So the beauty of technology, modern technology, is that no matter where you are in the world, if you have access to the internet, there are resources out there that you can look up. So there are apps. If I can plug one, one that I refer to quite frequently is called Go Grandparent. And that is a web page where you can get on, sign up for a subscription, and they'll work with you and your family and setting up things like Uber and Lyft transportation and having those drivers kind of in communication with you for the pickups, the drop-offs, and these kinds of things. So if you're a care person and you're at work and your loved one needs to get to a doctor's appointment, you can kind of arrange that and be speaking with the drivers and get a confirmation that they were dropped off and all of these kinds of things. And there's a couple of other websites and apps and these kinds of things that are out there. If you have Medicaid, especially in the state of Kentucky, if you have Medicaid, there's Medicaid transportation. You just call your Medicaid office and they should be able to point you into which Medicaid transportation service comes to your area. There's different ones for different areas. No matter where you are in the world, if you have access to the computer, that's something that you can look up and say, you know, what kind of transportation services are available in my area. If you have physical limitations and you need some accommodations like a wheelchair, a walker, accessibility, we would call that non-emergent medical transportation if you're looking things up there. So emergent medical transportation would be your ambulances. You call, here in the U.S., you call 911 and they send an ambulance for you. But no matter where you are, this would be a non-emergent medical transportation.
Yeah, exactly. And are things like that, if you go through Go Grandparent to use Uber Health or something, for example, is something like that covered by insurance yet?
Typically not. Typically these are a subscription service. There are some exceptions to these kinds of rules. Certain insurance companies, commercial insurances, Medicare replacement plans, things like that can offer transportation service as a benefit. And they may offer a discount for one of the transportation services.
Oh, okay. That can help choose.
That can help you kind of narrow things down for you there. So just calling them and saying, hey, what do I have? What options do I have for transportation? It might not be anything, but it also you might be pleasantly surprised. Sometimes when it comes to insurance, the transportation benefits aren't added unless you call and ask for it to be. So give them a call, see what they're going to do for you.
One of those you have not because you ask not situations.
Yes, I like that adage there.
Yeah. And then how do state laws and medical guidelines determine whether a stroke survivor can return to driving? We actually answered that in a previous episode with attorney Cameron Fattower, so check out that episode. What role can caregivers and family members play in supporting stroke survivors who are no longer able to drive?
I think a couple of things. Number one, coming from a place of understanding. This can be really overwhelming. This can be really scary, completely uncharted territory. So coming from that place of, okay, let's look at this in a big picture. If you come in and you just swoop in and say, this is what I'm doing, here we go. Well, hold on. We might need to talk to the person, see what their wishes are, and see what they're comfortable with, if that's some kind of care that they're comfortable with in that way, and just have this kind of conversation with your care person and as to what they would like to see happen. And sometimes you do have to have that conversation of, hey, I really do feel comfortable driving you. It really is not a big deal for me to take you to appointments on my lunch break. It's not a big deal, you know.
And sometimes, especially if you're coming from further away, it may be an all-day trek to get somebody to a standard follow-up appointment.
Sure.
Because you've got to drive a couple hours maybe to get to a specialist office. I know you and I have definitely talked to our mutual patients about things like that before.
Absolutely.
And in those scenarios, if someone has to take a day off work in order to transport their family member to appointments, are they able to apply for things like FMLA and things that at least protect their job so they don't have to have like absences with penalties and things like that?
Absolutely. If you've been at your job for more than a year and you want to apply for FMLA to be the caregiver, that is something that is pretty common, is to say I have to take a day, FMLA day, to drive my loved one to their doctor's appointment in Louisville, or drive them to Lexington, or things like that. So that's a really common thing. Talk to your employer, your HR departments about the FMLA paperwork, and you can take what's called intermittent FMLA. So you don't have to take off this full 12 weeks all at one time. You can use it somewhat as needed in that way.
And you don't necessarily get paid for that time that you're not working, but your job is safe and you're not in trouble with your boss, basically, right?
Yes, they can't hold it against you, penalize you for that.
That is really good to know, and I feel like that's not common knowledge, so I'm really glad that you were able to speak to that today.
Yeah.
Are there community programs or services that provide transportation assistance for stroke survivors?
Absolutely. Absolutely. We have community programs through Medicaid. We have community programs through companies here locally. We're in the Louisville area. And here in the Louisville area, we have things like TARC 3 that are a non-emergency medical transportation service. And you may have something like that in your area. There are often volunteer organizations, especially if you're a veteran and you work through the VA. Contacting them to see what kind of volunteer services they have, speaking with churches and other community volunteer programs.
We've met quite a few veterans, I feel like, over the years that we've worked together who they never utilized their veteran benefits, and then they have a medical emergency like this, and all of a sudden they need help, and they didn't even know they had access to all these different benefits. So look into your local VA office and what might be available to you, and just talk to the person and they'll get your information and make sure you get connected to what you're eligible for.
Right. And even if it's not an individual transportation program, you can utilize it by utilizing caregiver assistance programs. And then that caregiver can transport you to places.
Exactly. And how can healthcare providers like doctors and nurses help patients navigate disability benefits and transportation resources?
I think being educated to what resources are out in your area. If it's something that you're not comfortable with as a provider, then finding out who is comfortable and having those
go-to person. Find your Caitlin is what you need to do. So if somebody needs help getting somewhere, I say, I know just the person for that.
Right, exactly. So knowing who is in your community, it may not be a social worker. It doesn't have to be a social worker to be knowledgeable for transportation assistance.
A lot of community health workers now are addressing exactly that issue.
Absolutely. In Kentucky, we have a lot of community action organizations, so it may be getting in contact with them and just calling them up and saying, hey, I work for this office. I just wanted to know, what do you guys do? How do you help people? They'll oftentimes may come out and even speak to your office and say, here, this is the education that we provide.
And sometimes it's really good to know who to actually call, who's the contact person in that office, so that you don't just get a wrong number.
Absolutely. I think it can be so powerful for a family if they're leaving an office and they're feeling overwhelmed, they're feeling very discouraged and scared because they've had a stroke and there's big changes in their life. If you can say, you know what, call so-and-so, they've got some stuff, you're going to be able to be helped by them. That can be so validating and so powerful.
Very reassuring. I'm always reassured whenever I get to send someone to you because I know they're in good hands.
I try. The thing is, you don't have to know everything. You just have to have this kind of will to want to help. I may not know what to do, but let me try to figure out who I can call who does know.
Exactly. And just approaching it with a spirit of curiosity, right? Instead of saying, oh, that's not my job, or, oh, I am not the person. Well, who is? And are we as healthcare providers more likely to be able to find someone who can help than maybe someone who's not from here and doesn't know how to navigate the system? Yes, we are. So I'm really glad to be able to team up with you here at the Resource Center for that. So let's talk about advocating for improving what's available, because what's available in the cities is not available in the rural areas, because there's a lot of deciding who's going to pay for what, right? And what's a priority. Well, our city, our county, and our state leaders make decisions based on the feedback that they get from their constituents. And all of us are constituents of something.
Yes.
So if you see a need in your community and you think that it's reasonable to say, you know, this needs to be provided, then that's something you can start talking to the leaders of these organizations about. There's a need for this in the community, and let your voice be heard, because the squeaky wheel gets the grease, right?
I love that one. That was one of my favorites.
Yeah, I'm just pulling out all these clips with Caitlin today. But how can stroke survivors, do you think, advocate for better transportation options and accessibility in their communities?
You know, one of the things I always say is, if you're a community leader, you can't do something about a problem if you don't know the problem exists. So whether it's write a senator, send them a letter, send them an email. You know, they can't fix a problem they don't know is there. So speaking with local community leaders, saying, hey, you know, I needed to get my dad to a doctor's office, but we didn't have transportation in this community. 2 counties over, he could have used this. Why can't we get that?
And if they're not responding to your messages, go to the town hall and ask in front of everybody. I mean, that might sound really intimidating, but I know you and I both find it's a lot easier to advocate for someone else than even for our own selves. And so if your family member is in need of this, you know, you're in a really great position to speak up for them and the other people like them who aren't able to speak for themselves, to just let them know what the need is in the community, right?
Absolutely, absolutely. If you speak up in advocating for your loved one, then the fallout from that is other people's loved ones can benefit from resources that are put in place for what you advocated for.
Mm-hmm. And what strategies can stroke survivors use to stay connected and engaged in their communities despite those transportation challenges?
And we go back, and I already mentioned it once before, the beauty of modern technology, isn't it?
It's like we came full circle.
Oh my gosh, look at us. We've done it, haven't we? But, you know, there are things like, there's a lot of virtual support groups out there for stroke survivors and stroke caregivers all over the nation, all over the world. You're already doing some of it if you're watching one of these videos or podcasts here. So you're already reaching out and educating yourself. And then always just kind of feeling comfortable and being open about, okay, this is where I am and this is what my struggle is, and seeing what other supports are in your area and what other people you can rely on.
Yeah, exactly. And I will go ahead and plug here for the Norton Neuroscience Institute Resource Center. There are a lot of virtual programs that we started offering during the pandemic that had all been in person before, but now there's like neuro yoga, neuro tai chi, Feldenkrais, which is another like somatic practice that you can do virtually, as well as support groups that are discussion oriented. And in all of those things, like they are offered in person as well, but there are a lot of virtual options, even music therapy and things like that you wouldn't have thought might be an option. So definitely check out the Norton Neuroscience Institute Resource Center page on nortonhealthcare.com. If you want to find out more about the NNI classes, they are all free, and you do not have to be a patient of Norton Healthcare to participate. It is just free to anybody who wants to join, but you do have to sign up.
Yes.
So that you can get the Zoom link.
Yes. You know, you don't even have to be in the U.S., and we've had people log in from outside of the U.S. I don't know what time you'll have to get up.
But yeah, like if you're logging in from some country in Africa or something, then, you know.
Yeah, I can't speak to what time you have to get up to participate in that, but you know, you don't even have to be here. So it's just kind of connecting with other people going through the same things. It goes back to that validation of your feelings. Yeah.
Exactly. So, well, thank you so much, Caitlin, for everything you do every day that I get to see, and then also for sharing this input with our listeners, because it's definitely something that a lot of people struggle with, because, you know, stroke is the #1 leading cause of disability in the world. And those numbers are not going down. So the more we can do to address these needs, the more we can prevent disability, because if people have transportation to their doctor's appointments or their physical therapy, occupational therapy, speech therapy, or vision therapy, then they can be more independent, less disabled, maybe return to work, or at least have a lot better quality of life than if they are stuck at home. So I hope you've gotten a lot out of this episode. And if you have any comments about what would be helpful that you'd like to learn more about, if this got your gears rolling, then leave us a comment and let us know. And I'll see you in the next episode.